Hello, my name is Anthony Maggi, and today I will be presenting my research on the appendix and the inflammation of the appendix known as appendicitis. I chose this topic as back in the fall I had appendicitis and ultimately an appendectomy. As an introduction, these are the topics I will be discussing in today's video. The appendix, what is it, where is it, what's the function of the appendix? Appendicitis, why people get it, symptoms, and how to diagnose it. Appendectomy, which is the removal of the appendix, how they go about removing it, and alternative antibiotic treatments. So, what is the appendix? The appendix is a small organ found in the human body. It is also found in the great apes, other primates closely related to humans, the opossum, the wombat, rabbits, and a rodent in Africa called the mole rat. Though I didn't put time into researching it, it is interesting that us humans have similar evolutionary traits with a marsupial and a rodent. So, the human appendix is about the size of your pinky finger, and it is located between the cecum and the ileum. The cecum is the beginning of the large intestine, and the ileum is the end of the small intestine. Here is an image of the connection between the cecum and the ileum. This is a close-up on the lower right abdomen. The appendix is also labeled in this image. As you can see, it is connected to the cecum right where the ileum ends. The green arrow I drew points out the opening of the appendix. Food we chew goes through the small intestine, through the ileum, into the cecum, and travels through the large intestine, where it is then disposed of. So, why do we have an appendix? What's the function of the appendix? Previously, Charles Darwin believed the appendix to be an evolutionary remnant, nothing more than a vestigial organ. And to back that up, in 2007, researchers from Duke University Medical Center found the appendix to have been around 80 million years old. However, they came out with their own conclusion that the purpose, they said, is a safe haven where good bacteria could hang out until they were needed to repopulate the gut after a nasty case of diarrhea, for example. Even more recently, this idea has been put to the side burner, as when I asked my surgeon what the importance of the appendix is, he could not answer the question. So now that we've talked about the appendix, let's talk about appendicitis. Appendicitis is the inflammation of the appendix. The cause for appendicitis is unsure, however, the main theory has it due to an obstruction of the appendix, the opening of the appendix. The appendix can be blocked by an overgrowth of lymphoid tissue, food wastes, small pieces of hardened stool, worms or other parasites, foreign objects, or a cancerous tumor. If left untreated, it can rupture, leading to severe infection and potentially death. Genetics can also be another reason for appendicitis to occur. There's not really a lot of data to support any conclusive reason, but to add my 2 cents in, my mother had appendicitis as well as her 2 parents. So both my maternal grandparents had appendicitis. Here's a comparison of a normal appendix next to an infected and inflamed appendix. Here the inflammation is very obvious in size and color. The inflammation could be due to something blocking the opening of the appendix, which I put an arrow to. Here are the typical appendicitis symptoms. There's no one symptom that is obviously appendicitis. Here are symptoms with confirmed cases of appendicitis and the percentages of patients who reported each one. So nausea is 85%, that goes with vomiting. Pain in the lower right abdomen is 80%, loss of appetite 74%, fever 60%, diarrhea/constipation is 18%. In my case, I only experienced minor pain in my lower right abdomen. This led to major confusion with the doctors. They kept asking me if I had a fever, and that was a big one, and I never had a fever. So a couple days went by until they took me to a CAT scan and figured out that I had appendicitis. So, how is appendicitis diagnosed? Typically, it's self-diagnosed, with pain in the lower right abdomen being the number one symptom. Ultrasound, if doctors really aren't sure, they'll ask for an ultrasound of your lower right abdomen. Ultrasounds use high-frequency sound waves to capture live images. And to go a step further, they'll order for a CAT scan, which is a cross-sectional X-ray. So it's X-rays on multiple axes. Now, in my case, they had to go all the way to CAT scan in order to figure out that I had appendicitis. The day before I got a CAT scan, I had an ultrasound, and they couldn't figure it from that. So now that you have appendicitis, you have to get rid of the appendix, or you have to treat it. And the most common way of treating it is through an appendectomy, which is the surgical removal of the appendix. Two most popular ways of going through an appendectomy, are through open surgery and laparoscopically. Open surgery involves a bigger incision directly over the appendix. The appendix is then tied off and removed. Sutures and staples close the remaining incision. And laparoscopic surgery involves 3 to 4 much smaller incisions. The surgeon uses a camera called a laparoscope to view his work. Tools are operated from outside the body cavity, but everything is going on inside the body. Here's a really good video showing the difference between open surgery and laparoscopic surgery. I really doubt it's going to play in class, but I'll put the link in the bio, and hopefully we have time for that. So, if appendicitis is an infection, why not just treat it with antibiotics? Why go all the way to surgery? And from 2009 to 2012, the Appendicitis Acuta Multicenter in Finland ran a trial to find out if antibiotics are just as successful as surgery. They randomly picked 530 patients with confirmed appendicitis, ages ranging from 18 to 60, and randomly gave them the choice for either surgery or antibiotics, with a follow-up after 1 year. So randomly, 273 patients got surgery, and 257 got antibiotics. All but one of the 273 surgery patients underwent successful appendectomy. Of the 257 patients undergoing antibiotic treatment, 70 needed an appendectomy within 1 year. This leads to a okay success rate of 72.7, but not nearly as good as the success rate of 99.6 with the surgery. I myself underwent antibiotic treatment for the first 2 weeks, as it wasn't sure whether or not I had appendicitis. I had, in August to September, I had antibiotics, and then in September, they decided, it's probably best to just take it out, as it will probably come back. And in December, they took it out and tested my appendix, and it was confirmed that I still had appendicitis, even though I underwent the antibiotic treatment. In conclusion, the appendix is a mysterious small organ. Not much is known about it. The location is between the cecum and the ileum. Blockage of the appendix can lead to inflammation and appendicitis. Through CAT scan and ultrasound, doctors can determine diagnosis. They can also determine the best method for surgery through the CAT scan and ultrasound. Surgery is more ideal than antibiotics, which was true in my case.